Hi, I'm Dr. Celia Dyer. I'm a general dentist in Atlanta, Georgia, and I'm here to talk with you today about toothaches. That's one of the main reasons people need to find a dentist in a hurry, and there's several reasons why you could have a toothache. If you feel like you have a toothache, it's on the left side of the lower jaw, and maybe it is or is not radiating down your neck, that actually could be the sign of a heart attack. And if you think you're at risk for a heart attack or not, or you have those symptoms, you should call 911. If you have a toothache, it might be in the upper jaw, and it might be related to sinus problems and be unrelated to a dental problem. And so if you will see your dentist can rule that out, whether it's a dental problem or something else. You could have had some dental work recently and maybe had a filling replaced, and the tooth, after the numbness wears off and for several days and weeks going forward, becomes sensitive and is sensitive maybe to hot or to cold or just aches all of the time. And that could be something as simple as the filling is just a little bit high and needs to be reduced and shaped a little bit differently, just ever so slightly, makes a huge difference. You know, you can feel something as thin as a human hair between your teeth. So just the slightest excessive height in a dental filling can cause a toothache that can be solved at very little cost and little time by the dentist just reshaping that when you're not numb and you can bite harder. A more common cause of a serious toothache, the kind that just you feel like you need a narcotic painkiller, this is usually due to either decay that has entered the pulp chamber, some other injury or trauma to the tooth that has damaged the pulp chamber, and that's the inside of the tooth that contains the artery and the vein and the nerves. So that might be caused by, again, an injury, a break, or something that exposes the inside of the tooth to decay or to bacteria in the mouth, and so you might just have a big cavity that has gone ignored for a long time, and now it's into the pulp chamber. And so now you have gotten, sometimes this will not have infected the pulp, it's reversible, and just taking out that decayed part of the tooth and replacing it will solve the problem, and the dentist protecting the pulp there, and that might solve the pain. But if it has gone all the way into the pulp and actually infected the pulp chamber, then you have an abscess tooth, and you've heard that term before. And your dentist, with an exam by X-ray, can see on the X-ray where you have some of this infected material has actually come out of the tips of the root and it can be seen in the bone, the jawbone below the roots of the teeth. So if you've gotten an abscess tooth, then either your dentist, or perhaps if he or she wants to refer you to a specialist, can send you to an endodontist, but someone needs to do what's called a root canal, which is just the removal of the nerve inside the tooth. And you get immediate relief, almost immediate relief from the pain, and you might be put on an antibiotic if it was a serious abscess, and you probably would return in a few weeks, and then a kind of a rubber material replaces this space in the tooth. And you might then, after that, be recommended to have a crown put on the tooth to protect the tooth that no longer has the living tissue inside of it. But those are the main reasons people get toothaches, and if you have a toothache, you don't think about anything else until you get a dentist. And so if you don't have a dentist and you have a toothache, you need to go to appointmentcity.com and click on Find an Appointment so you can be seen by a dentist and get rid of that toothache. And I'm Dr. Celia Dyer, and that's the appointmentcity.com dental tip of the day. Thanks.